doctors, it's Dr. Siddharth here. So now we are just going to look at some of the previous year NEET PG questions that have been asked along the answers. So the ideal thing to do would be go through all the anesthesia video lectures. In that, most of these questions have been covered with a detailed explanation. So right now we're just going to revise it quickly like a rapid fire, and we're just going to have a little bit of theory part in between. So we are going to first look at the 2021 questions. A patient undergoing surgery with halothane anesthesia develops severe hypothermia and muscle rigidity. So hypothermia and muscle rigidity. What does it tell us? It tells us about malignant hypothermia, the most probable cause. Which of the following agents could have also contributed to this condition? Usually it's caused by succinylmethonium, that is succinylcholine, or inhalational agent. So the answer here has to be succinylmethonium. Yes, it's true. Answer C. So next question is, which is the last structure encountered while doing lumbar puncture? Obviously, while doing lumbar puncture, our idea is to enter the subarachnoid space so that the CSF comes out, and obviously the last structure that you will be hitting will be the arachnoid layer. So again, the layers of anesthesia in case of a midline approach will be skin, subcutaneous tissue, supraspinous ligament, interspinous ligament, ligament flavum, dura, subdural space, arachnoid, and the subarachnoid space. In case of the paramedian approach, you will skip the supraspinous ligament and the interspinous ligament, and you will be going through the paraspinous muscle. Yes, the answer is C. A young male patient who received regional anesthesia with 0.25% bupivacaine becomes unresponsive and has an unrecordable pulse. What would be the best course of action for the patient? Unresponsive and unrecordable pulse means mostly the last has set in, and these patients will require CPR with 20% intralipid. Yes, true. Now this is something that you have to remember, the drugs while giving regional blocks. Okay, the most commonly given drug is bupivacaine. What you need to understand is the concentration. Okay, any concentration of bupivacaine which is 0.5% and above, more, okay, is used for anesthesia, that is to knock out everything, whereas anything 0.5% and lesser is for analgesia, for pain relief. Same with levobupivacaine, it's the same, 0.5% and above is for anesthesia, 0.5% and below is for analgesia. In case of ropivacaine, anything concentration of 0.75% and above is for anesthesia, okay, and anything 0.75% and below is for analgesia. So remember this. Next, which of the following is the best method to confirm the position of the endotracheal tube? Is it chest expansion, X-ray, auscultation, or capnography? It is capnography. Of the options that have been given, capnography is the best. The gold standard for confirming endotracheal tube intubation proper is fiber optic examination. Okay, so gold standard is fiber optic, but the best method is capnography. Correct. Consider the following image done for management in the airway. What is it? It's basically head tilt and jaw lift. Basically what you are doing, you are taking off the tongue from occluding the posterior pharyngeal wall. In 2022, what question was asked? What is the most used nerve for monitoring of patients after anesthesia? Okay, for nerve block, for muscle relaxant, what nerve are we monitoring? It's always the ulnar nerve. Ulnar nerve is the ideal nerve to monitor. You look at the adductor pollicis muscles reaction. In 2023, when should a patient be positioned in the given position? So usually this position is put when the patient is unconscious, but both pulse and breathing are present, meaning they have been resuscitated, but you don't want them to aspirate. So you put them in this position. Unconscious patient with both pulse and breathing present. Yes, that's the correct answer. In which of the following conditions this device is not used? So, okay, so basically it's for airway management in case of prolonged ventilation, and you can also use for pulmonary toileting. It is not a part of airway assessment. Answer is A. What is the antibiotic of choice in patient portion for elective cardiac surgery? Always we use a second generation cephalosporin. So the answer here has to be cefazolin. Yes, cefazolin is the answer. In 2024, What was asked? What is the relieving pressure of the pop-off valve in the given? Okay, it's an ambu bag, and the pop-off valve pressure is usually 30 to 40 centimeters of water. And this is how they will confuse you, because see the next option, it is 30 to 40 centimeter of mercury. So this is how they usually tend to confuse you. So next question is following image represents. So what can, okay, so basically it's a tourniquet. You can see a tourniquet and you can see an IV line. So this is definitely the bias block. Yes, correct. Phase 3 in the image represent phase, phase 3 is basically alveolar plateau. So this is inspiration, this is beginning of expiration, this is plateau, and this is inspiration, downstroke again. Answer is A. What is this position? Okay, this is the position for intubating. This is called the sniffing position. This is extension in the atlanto-occipital joint and flexion at the cervical joint. Extension should be at least 85 degree and flexion should be at least 35 degree. Using this position, all the oral, laryngeal and pharyngeal axis come into a straight line. It is very, very important because you need a direct view of the glottis, because when you are doing laryngoscopy, your only source of light is the laryngoscopy bulb, and as you all know, light travels in a straight line. Yes. Which of the following can lead to malignant hypothermia? So it should be inhalational agent or succinate methacholine. So here the only option that's inhalational agent is halothane, so it has to be halothane, option C. Which of the following statement about PEEP is true for patients placed in prone position? Increases CO2 excretion, prevents atelectasis of the lung, increases O2 inhalation, none of the above. So basically you need to understand what is PEEP. It's positive end expiratory pressure. So basically you are ventilating the lung, air is going in, inflating the alveoli, and during expiration it alveoli collapse and air is pushed out. PEEP, as the name suggests, peak end expiratory pressure. It's the pressure that is kept to make sure that the alveoli do not collapse during expiration, and the main function of having PEEP is to prevent atelectasis of lung. Yes, B is the correct answer. A COPD patient on mechanical ventilation suddenly develops hypoxia with absent breath sounds on the left side of the chest. Okay, COPD, absence breath sound on left side of chest, who's been mechanically ventilated, and increased intrathoracic pressure. What is the most likely diagnosis? COPD, pneumothorax, pleural effusion, or ARDS? It's definitely pneumothorax, because you can see a COPD patient, mechanical ventilation, both of this put together, you can definitely make sure the patient would have most probably had a bulle and which would have ruptured while doing mechanical ventilation, causing pneumothorax. Yes, the answer is B. Which of the following agent is used for immediate reversal of vecuronium in a patient with normal kidney function? So obviously it's Sugammadex. Sugammadex is the reversal agent of choice for rocuronium, but it can be also used to reverse vecuronium. Yes, it can, the dose of Sugammadex can be anywhere from 2 mg per kg to as high as 16 mg per kg if you want immediate reversal. Identify the given image. Okay, this is basically a nasopharyngeal airway. You put it in the nose and it lifts the tongue from the posterior pharyngeal wall and opens up the airway. Answer is E. A 2-year-old child undergoing CPR is pulseless. Okay, CPR, 2-year-old child, CPR pulseless, and shows the following ECG pattern. Okay, what is the next step? So you definitely have to shock the patient. Give shock with 2 joules per kg, and it's best to continue CPR for 2 minutes. Yes, answer is D. Okay, next question is, which of the following statement is correct regarding EMLA? EMLA is eutectic mixture of local anesthetic. 1 gram of 5% cream contains lignocaine. 50 mg, no, does not contain 50 mg. It is equal mixture of, no, it is eutectic mixture of local anesthetic. It contains lignocaine, ropivacaine, no, it contains lignocaine and prilocaine. Methemoglobinemia is a complication. Yes, methemoglobinemia is a known complication because the breakdown product is O-toluidine. Okay, so option D should be the correct answer. Okay, that brings us to the end of these questions. Thank you.